and start recording this and introduce myself again, and thanks everybody so much for joining. Looks like we have a good crowd. We have about 14 people on the line today. Hopefully everybody's all ramped up and excited about the idea of applying to CADCA outcomes and getting their successes potentially highlighted at a national level. Again, my name is Andrea De La Flor. I'm the Senior Manager here in CADCA's National Coalition Institute for the Evaluation and Research Department. I think there's a number of you that I actually don't know, which is really exciting. There are people who have applied 1 or 2 times before, and I've had the pleasure of working with them, and I know a couple of people who are thinking about applying again, and so I look forward to working with those people again, but it's always nice to have some new people, some new folks to meet and to work with on this, because we do work very closely with the applicants. So for those of you who don't know me or who don't know much about this program, I wanted to be able to provide a little bit of an introduction. I've been working here at CADCA since around 2007. I was a SAMHSA CSAP fellow. One of my first projects was GOT Outcomes. And so this has been a really exciting process for me. As much work as it has been, it's really been the #1 way that I've learned what I know about coalitions, is really from you all and from this application that I'm going to be talking about today. Because if you've looked over the materials, and hopefully you do have them in front of you, because we're going to be walking through them together, you'll see that we ask for quite a bit of information. So it really is a great opportunity to hear what the coalitions are doing across the country. So I wanted to go ahead and just kind of share what the plan is today, is to just go over the, that's slide 3, to go over the award process a little bit, the award program, what it's all about, what you can expect. I'm going to walk completely through the application materials with you. I have them in front of me, so I'm going to make sure that we cover all of the things that are most important, the kinds of support that we're going to be providing, and then also I'm going to give you some tips and some thoughts about next steps and what you can do to set yourself up for success. So the National Coalition Institute has been around since 2002. I got rid of these slides that, kind of like the boring slides that just say all the text, and I replaced it with some images for you. So I was really proud of that. We have the National Coalition Institute. That's one of our publications. We've been here for quite a while. The goal really of the Institute is to develop the capacity of coalitions to be more effective. And so we do that with training, technical assistance. Again, I said I'm part of the Evaluation and Research Department, and this program is housed in that department due to the emphasis on outcomes and assessment and data. But the Institute also really follows the strategic prevention framework, which I'm sure all of you, I imagine, are very, very familiar with it, and also that framework really drives the kinds of information that we're looking for you to share in your application. I added some nice pictures of some of the winners last year at the National Leadership Forum, which hopefully many of you have had the chance to attend. It's a very big and exciting event, and the GOT Outcomes winners get to get on stage and receive their award and bring as many people as they can possibly bring to the conference and fit on stage. And it's a really fun way to sort of end this whole process. Again, this is really focused on outcomes and data. So I just shared with you here a little chart that comes from the Coalition of the Year winner from last year. I thought it would be fun. This is the kind of information and that you'll be sharing with us in your application. So as an overview of what to sort of expect and the timeline, is that the first and most important thing is that we really hope that all of you will contact us directly and let us know that you're planning on applying. This participation in today's webinar and registering for the webinar is really helpful. Why do my slides keep moving? There's a ghost in the system. This participation in this webinar is really helpful because I will now have all of your names, of course, and I'm going to be sending you these fun reminders about, are you still going to apply, or you have 2 weeks left. But basically, you should really get in touch, because it's those kinds of conversations that we have with coalitions about, okay, these are my outcomes that I'm thinking about sharing. Are we a really good candidate for the award? What kinds of things do we need to be sharing on the application, and how can we strengthen that? We don't provide in phase 1, this first phase of the application, a lot of feedback on your application itself, but we'll answer a lot of questions for you that I think will sort of demystify things even more after today, if you still have questions that are really specific to your own coalition work. But again, this is a phase, there are 2 phases of this process. I think all of you who've looked at the materials know this by now. The phase 1 of the application process does involve you sharing a lot of information with us, but the purpose at the same time is there's an expectation on the part of us as at CADCA as reviewers that you're not going to have everything sort of perfect, or that there's going to be a lot of room for improvement, which is what phase 2 is all about, is that opportunity to expand upon and receive really good technical assistance from us, individualized feedback. So in a way, you could look at the phase 1 application as sort of a really good draft of a potential phase 2 application, and we've set it up so that we ask you for a level of information that will help us decide who's going to move forward in the process. But you can see, again, the timeline here is that July 15th is the phase 1 application deadline. A team of us here within the National Coalition Institute, some of my colleagues in evaluation research, some in training and technical assistance, will review those applications. We'll inform everyone in August. We will give feedback to, again, all the semifinalists as they're moving through to phase 2, but we'll also give individualized technical assistance, we call it, to anyone in phase 1 who doesn't move to the second phase, but who really wants to know more about their application, and most people do, so we work with you on that. The phase 2 will be due in October, so there's quite a bit of a period of time for us to work with you on the phase 2 application itself. If anyone has any questions at any point as I go through this, just please feel free to type in the chat box, and I'll just address them as they come along. But the next part of this is that I just wanted us to all walk through together. We can pretend like we're walking on the beach, holding hands, even though we're all in our offices right now. But I have the applications in front of me, the application materials. I have one, the application announcement, which is a 2-sided document, and I have also the application instructions. So if you could all just take a look at, and again, I'm going to assume that you have in front of you these materials, the application announcement. I was going to walk through that a little bit first. The first piece of it that I really wanted to talk about was some of the eligibility requirements, which are on page 2. For those of you who have at least known about the God Outcomes Award or read the application before in the past, we have made some changes throughout the years, and we didn't make much of a change to the application itself, the materials, but this year we're doing something pretty significantly new, and that is that for the first time we're going to be offering an award to coalitions who can demonstrate that their coalition has achieved short-term outcomes, and I'll talk to you more about what those are exactly. But that really is a change. So that means that coalitions who've been around for less time are going to be eligible to apply. It means that coalitions who are maybe starting a newer initiative are also going to be eligible for an award. So the first thing that you really need to be thinking about is what outcomes, short-term, intermediate, or long-term, which again I'll talk in more detail about if that's not the language that you use. But you have to think about what ones you want to share. The other thing is that everybody who applies this year will just be applying to highlight their work in one substance area. And this is also different from the past. We had a coalition and focus category, it was called, where coalitions applied in one substance abuse area. But our coalition of the year folks, they had to at least share success in 2 issue areas. And what we really decided here is that there truly is usually a stronger area that even the coalition of the year who present more than one topic area share with us. And so for that reason, we felt like it would be a good move to just go ahead and allow them to share their best work. And also what was the other reason is that we just well, it was obviously it was going to be less time consuming for them to put that application together, and we know that in the past there have been some people who have not applied for a God Outcomes Award because of the time commitment. So we felt like streamlining it would be good. And then, yeah, the third reason was because this really is an opportunity for us to do some technical assistance, some helping the coalitions to work more effectively and gather data more effectively, and people often find that this process is useful in identifying gaps for their coalitions. And so that process that you'll go through with the application and through conversations with us, you'll be able to apply all of those lessons learned to another substance abuse issue area. So that was some of the thinking behind that change. And so this year, at the 2017 forum, all of the coalitions are going to be called God Outcomes Coalitions of Excellence. We're not going to have different categories, but we will have a Coalition of the Year. And the Coalition of the Year will need to be a coalition that applies and has achieved short-term, intermediate, and long-term outcomes. So you can be a Coalition of Excellence with short-term only, or short-term and intermediate, or short-term, intermediate, and long-term, but the highest scoring coalition that has short-term, intermediate, and long-term outcomes will be named CADCA's Coalition of the Year. And we don't put a number limit on the number of coalitions that we will give this award to. So we're just going to go ahead and see what applicants we get, and we will we'll move the highest scoring applicants to phase 2, and then we'll give the highest scoring applicants Coalition of the Year award. So I wanted to go through that a little bit. And before I go into really just the meat of the application, I'm still looking at the application announcement itself. And hopefully you all have seen the benefits on page 1 for the semifinalists and for winners. And I wanted to again point out a couple of new things that I think are really good for this year, a change. And that is that this year we're going to make sure that all of the semifinalists, and those are the phase 1 coalitions who apply and are selected to move to phase 2 of the application process, will receive a formal recognition letter from our chairman and CEO, Arthur T. Dean. And so that's something that I think will be really useful for coalitions to share with their communities, because they're really deserving of recognition and have demonstrated excellence just by simply getting to phase 2 of the process. So of course the winners will receive a letter also, but this is a new change this year. And we will also recognize those coalition semifinalists in our weekly newsletter that goes out to about 25,000 people, and that goes out once a week. So we're going to make sure to add some benefits there. And winners, I'm not going to read through all of them, but you're going to be coming to the forum. You get a discount registration for a coalition member, plus 1 free registration for another coalition member, lodging, travel. We added a pretty exciting membership to the Society for Prevention Research, which will mean that you would receive membership to their journal, or their research journal, and we will be able to consider some of these great coalition leaders for potential consultant status with CADCA. So I just wanted to cover some of those exciting things. Now is time to just get into the real nuts and bolts of the application. And on page 2 of the announcement, it says how to apply, and we broke down the steps of how you're going to apply for this. So I talked about this a little bit, but you're going to select one substance issue that you've decided your coalition wants to address and that you're going to highlight. You are going to decide what outcomes, what levels of outcomes your coalition has at this time, and then you're going to be creating a PowerPoint presentation for phase 1 that provides a lot of details based on what we're looking for. There was one thing that I wanted to say about the, okay, I'll remember later. So, all right, on the application itself. So we wanted the PowerPoint presentation to be the format of this because we really felt like your coalition works with PowerPoint. You've probably made presentations in the community. We're really hoping that by having it in a PowerPoint format, it actually makes things easier for you, that you'll be able to pull some materials together from some other things that you've already done, particularly when it comes to introducing your coalition, the mission, the demographics, where you come from. So that is the thinking behind the PowerPoint piece. I think the other piece that I want to just say before I go through the rest of the content is that God Outcomes is about the successes that you're seeing now, and so therefore it's really, the focus is to highlight the work that you've done in the past to achieve the success that you're seeing now. So that's a point of clarification that's important for people. I think sometimes is a little confusing, but it's the story of how your coalition contributed to what you're seeing today. And so we'll talk about, in this conversation, I'll be talking to you about baseline, or what's your baseline data. And that is really, you can think about it as the information, the data in your community that you feel was the biggest driver in the decision making around the comprehensive set of strategies that your coalition implemented to get to the outcomes that you're highlighting today. So you're kind of being asked to go into the past, which isn't going to be what you probably have necessarily on your current logic model, which hopefully is a living document, or your logic models. This application is going to require you to probably pull from different places, different documents, and to hopefully be not working alone, but with a group of people on this, including your evaluator or whoever's been helping you collect and organize data to do this. So it definitely shouldn't be something that only one person is stuck doing at midnight, the day before the application is due. It's going to take a little bit of time, but hopefully be a fun process. And again, I hear that it's a really good process for people to go through as a team, and they learn a lot. So I'm going to go ahead and skip to talking about step 3 and just move from the application announcement to page 2 of the application instructions. I'm not going to walk through every single one of these things because I know that a lot of them are pretty much self-explanatory. But basically what we're looking for in your presentation, and you'll have to read the formatting and the length requirements for all of this information. And you can choose how many slides you want to dedicate to what, based on your own coalition work and what you're most interested in highlighting. But we're asking you to give us information on your coalition, again, some of the demographics. I think a point that I want to bring out in this required content is regarding the list of community sectors. So for this part, it's again the list of some community sectors, so whether that's your law enforcement, your schools, your health sector, the business sector, that have been the most engaged in the coalition work that you're highlighting, the coalition work that's already sort of completed. Of course, some of it is going to be ongoing, but the coalition work that you feel is contributing to what you're seeing today. And the point here is just, of course, as you know, coalitions are groups of active members and volunteers that bring together, you're bringing together all these different stakeholders. So we just really, it's important for us as reviewers to see how your coalition has worked and partnered with those in the community that are actually taking on some of the coalition work. So as you think about who you're going to highlight in this section, I know it's hard because you don't want to leave anybody out, and that's a process that you have to go through in this application, is sort of making these difficult decisions and this balance of what to share when there's so much going on and what you can leave out. But think about those that have just contributed, made the biggest impacts, and that the work that they've done, you think, has probably had the biggest contribution to the outcomes. It tells you how many we would like to see for phase 1, and you'll have the chance to expand upon that in phase 2. The list of what they're doing is just really a couple of sentences that would describe to an outsider pretty clearly what it is that they worked on. So I'm going to spend, I think, a good amount of time here talking about the PowerPoint templates that we've created for the God Outcomes application. I guess I'll just take a breather and see if anybody has a question right now before I move to sort of the more technical, data-heavy part of the application. Okay. Again, if you have any questions as I go through, just feel free to type them in the chat box. So at this point, I have a couple of slides. So there's, on the website with the application materials, you can download a couple of templates, PowerPoint templates, to get started with this big picture overview and data interventions. Basically, what we wanted to do is, knowing that everybody's logic models, their coalition logic models, are in different kinds of formats. There's different ways that you can put a logic model together. It should really resonate with your community and your coalition. And so how could we sort of get everybody on the same page so that we can assess the applications in a more uniform way? That was the first thing that we wanted to do, and that's why we created templates. But the other thing that we realized in the God Outcomes process over the years was, again, people really start to recognize some of the gaps that they maybe could need to address. And there's nothing wrong with having these kinds of gaps, because I can tell you, after looking at the applications over all of these years, everybody has things that they really need to improve upon when it comes to data collection and evaluation, and that's fine. Even the Coalition of the Year winners have gaps. So definitely don't feel concerned if you do notice that there are places in these templates where you don't have data or you're not sure, because it definitely will illuminate that for you. But that is part of the learning process, and you can also speak to some of your next steps and plans to address certain data limitations. So that's why we put these PowerPoint templates together, and hopefully they'll be useful to you in communicating your work. But again, the information that's going to go in them is going to come from different documents that I think your coalition has. And I, again, would suggest that you sit down with the folks in your community who are helping you with your data and evaluation work to do this. But the big picture overview is basically, well, this is a CADCA model where we're looking at the risk and protective factor kind of. I think many of you are familiar with that. If you don't know the CADCA, the but why here work that we do. But this is really just a like high-level overview of what the problem is that you've addressed. So for example, underage drinking is a popular one, so I'll just use that example. But it's a problem statement. So if you haven't created a problem statement before, or been asked to create a problem statement, we have materials on that, and we can help you with that. But it would say something like, underage drinking is a problem in such and such county, or whatever community it is that you're covering. So you would actually write a sentence that describes just that one problem that you're highlighting your outcomes for in your application. The next piece is what we call root causes, and you could also refer to them as risk factors in the risk and protective factor model. We're really looking at trying to see what community level risk factors the coalition has been addressing. And so again, these are statements. So it would be youth have easy access to alcohol in somewhere county, or in the city of Alexandria, whatever your target community is. Or another one might be we have something about maybe consequences or the policy environment in your community, or like law. Some people say laws and norms are favorable. I like to get a little bit more specific, but laws in our community permit underage drinking, for example. So however you want to describe it, but as you can see, it's a sentence, and it's still very generic, and you need to know more if you're going to be able to address that, because all of those things are pretty much happening in any community. So we ask you to then dig deeper at the local condition level, and we ask you, but why is that happening here? And so I'm just going to flip to another slide that I think will depict this a little bit better, and then go back to the big picture overview. But I think the general takeaway here is that the big picture overview is going to be a sort of like a title page or a cover page to the details of the data to support this problem statements that your coalition has addressed successfully, because these are the issues, and you'll be sharing with us how you've changed the data in a positive way that describes each of these issues, and those are your outcomes. Hopefully that makes sense. Maybe I'll just ask people to chat in the chat box. How many of you are familiar with, wait a minute, I'm going to say, how many of you are not familiar with CADCA's but why here, local conditions? Just to see if there's anybody this is new for. I'm assuming that people can still hear me. If you can still hear me, oh, somebody's typing. Okay, sometimes you don't know if, thank you. Okay, well, so it sounds like we have basically people here who are really familiar. Thanks, Keisha. I'm glad you're on, because I was going to connect with you. I'm familiar with the process, so I'm just going to kind of, okay, I'm just going to sort of go through. This is a visual, right? So, but why here? So you've got the problem, you've got the deeper level, the root causes or the risk factors that still look the same in every community. What we are really going to be focusing on is local conditions. So if you've been on all the CADCA stuff, you've heard local conditions, local conditions, local conditions. Some really good and helpful information, I think, is that these are conditions in your community at the community level that you could take a picture of, you could draw it, you can see it happening as it's happening. And these are the community, they're unique to your community. So sure, they could be happening in another community, but they bring out that really uniqueness about your community. And they all together are the things that drive the root causes. So to kind of try to put it in a slightly easier way, you have, say, students in the student survey are saying alcohol is easy to access. And you want to know, okay, well, in our community, how exactly are they accessing it? What does it look like when they actually have alcohol in their hands? Is it at a house? And then you think, okay, at a house, that's good information to know if most kids are drinking at a house. But it would be better to know, do you live around a college? So is it at house parties near a college community? And a lot of high schoolers are going to the college parties and they're drinking, and the college students are giving them beer. Is that happening? Is it just smaller parties that are happening in houses? Is it definitely a lot of parents in your community are providing alcohol and hosting big drinking parties? So what we're asking in your local condition is that you're able to really truly describe those very specific scenarios. And usually there's a few of them. There's no set number of root causes or set number of associated local conditions, but we feel like, you know, if you're addressing, say, 2 to 3 of the most significant root causes that are contributing to your problem issue, and 2 or 3 for each of the root causes, local conditions that are contributing to, you know, why that is happening. So if it's access, how that's happening, and that if you knock all of those things down, it'll be like a domino effect against your problem. So you'll change all of those little community conditions. Those community conditions will change perceptions in the community about access, about norms, about consequences associated with drinking in this example, and all of that change will come together and drive down the problem. So we think about it as a domino effect, and you can't get too specific with local conditions ever. So again, looking at the big picture overview and going back to your statements, we're looking for a local condition statement that would say, you know, kids are drinking at house parties with parents providing the alcohol to them, for example. What else? Just a little glitch, a photo. Sorry. We just saw a photo of Douglas Rice is blocking my PowerPoint presentation. Doug is right here, so maybe he'll work on this while I continue. I'm sorry about that, Lorianne. But luckily we're working on mostly the application materials, so everything that I'm talking about should be fairly accessible to you. Okay, so did you fix that? Yeah. Okay, I think that Doug fixed it. So, thanks. So, all right, going back. So you've got your big picture overview. Hopefully I haven't confused everybody already. Big picture overview. It's the cover page to the data interventions template. If anyone has better terms for these, feel free to send a suggestion. But the data interventions template is, I see someone's having an audio issue. The data interventions template is where you're going to put all of the data that describes all of these statements, that backs up all of the statements that I just told you about. So what you're looking at here on this slide, and Dawn, I'm sorry, well, she doesn't have audio, so she can't hear me. What you're looking, for those of you, technology is just so much fun. For those of you who are looking on the slides right now, we are typically looking for 2 data sources, at least, for each of these statements that you talk about. Some things that I can suggest to you would be that we'd like to see not just student survey data, but we'd like to see some qualitative data, whether that's observational kind of stuff that you've done. You're looking at maybe supporting it with some local kind of consequence data or some conversations that you've had with youth, stakeholders, stakeholder interviews, any other information to just support your survey data, because as you know, every piece of data has its own limitations. So basically what we're just looking for here is a couple of pieces of information that describe and kind of paint a picture of that particular issue. An example would be, let me see, well, I'll also say that for local conditions, a lot of times you're not going to get that level of information, that level of detail that I just told you about. You don't have a student survey typically that gets beyond just, where did you get your alcohol? Was it at the home? Was it in a restaurant? Was it at a bar. You're lucky if you get to that detail, but even if you do, since we're really looking for the additional information, we're hoping that coalitions are going out and having conversations with young people about what that setting looks like, or with parents or teachers, again, the key stakeholders. So don't be afraid of using qualitative data. I know that there's different levels of rigor, I guess you would call it, that's sort of occurring at the local level. But from what I have conversations with coalitions, pretty much all of you are talking to people in your community on a regular basis, and there may be more limitations than others for certain qualitative data points, but it's better to share with us at least what you can about the qualitative data that you have than to just leave it off completely because you don't feel comfortable with it or you don't feel like it's good data. So you can see here that what we're looking for is also that baseline year that I talked about, which is probably going to be around the same date for all three, but it just depends because some coalitions didn't start collecting good local conditions data until a little bit later, but they are able to see movement on that data. And so it really depends. Again, the baseline information isn't going to be when your coalition started, because your coalition could have been around for 25 years, but it's the information that made your coalition decide this is what we're going to do. And it's that local conditions data that allows you to know enough specific information so that you go out and you target the right things and you use your resources in the best way possible, targeted toward these unique conditions. So once you have put all of your data that you have to describe all of your statements about the issue, you are then going to be describing the work that you did. And that is on the right side, the strategies and interventions piece. And so what we've provided with you to you is that other document on the website that's called the applicant reference document. And if you don't have it in front of you, that's okay. But it basically gives you a definition of all of these different terms. And one of the things that it gives you on the second page is the 7 strategies for behavior change that we train at CADCA. And it's basically just a way to organize the work that you're doing. And again, as a sort of a technical assistance or support tool, it really identifies for you places where maybe you could be doing a little bit more work. So you will be able to see, oh gee, we're really just kind of providing a lot of information here with this particular local condition. We haven't done so much in the last 4, which we call environmental prevention strategies. And maybe you're going to need to do a little bit more around those, given that we assume that you all are working to affect change in the entire community and that your local conditions are community conditions. And so the research, and this comes from coalition research, that basically says that the more comprehensive yet complementary you can be, the more effective your coalition is going to be at creating the change that you're looking for. And we don't require all 7, but we hope that you can describe your work in a way that covers at least, again, some of the environmental strategy work and not just the things that affect the individual level. But we do recognize, for example, that changing physical design might not be something that you need to do for a particular local condition. So I think what it's really going to take for coalition applicants who've never applied before is sitting down, again, with your data, your logic models, your strategic action plans, deciding what outcomes you really want to highlight, what issue you want to highlight, the data that what you've done. I often work backwards. So, okay, you're sitting at a table having a conversation. This is what we want to highlight. Everybody then talks about what is it that we've done that we think most greatly contributed to that. What are the activities? What are the policies? What's the information? What campaigns? I know there's a lot of social norms campaigns. How have we worked with law enforcement? So kind of just jotting down all of those things, or if you have strategic and action plan, just writing notes there and saying, these are the things that have affected our work. From there, I think it's looking at the data that drove you to do that. And hopefully, in most cases, you had data before, although I know that sometimes there are things that you do that aren't based in data, and it's not always easy to get everyone on the same page about the importance of data, but hopefully you did things because they had data behind them. And so it's what data drove us to do these things, and that's where you're going to get the problem, the root cause, and the baseline local condition data. I'm trying to think if there's anything else about that process besides just I think that working backwards is a really useful way to go. If you've never organized your strategies before in the 7 behavior change strategies, don't worry if you sort of get it wrong. Just try your best, because we can at CADCA take a look at the descriptions and we know if something should fit in another category. You're not going to get dinged on that. That's going to be part of a conversation that we can have with you later. So the most important thing is being able to get your data in there, have a couple of data sources, different types of data. Even if you're afraid of qualitative, just stick it in there, what you know. Talk about what you've already done, organize it the best you can, and describe it in some sentences, brief descriptions, in a way that anyone who doesn't know anything about your coalition is going to understand. So I would suggest that you maybe sort of have someone who doesn't know much about your coalition just check it, and if they ask you, what does that mean? They can help you decide to clarify some of those things. So does anyone have any questions about all of that? It's a lot, but the assumption is that you have a lot of this, and that you have people at the table who are going to be able to help you with this. So it shouldn't, again, rest on any one person's shoulders. And hopefully you'll be able to build off of some of the things that you've done before or shared before. And once you actually start digging into these things, it just becomes more tangible and not so, well, just me talking on and on about all the details for a long time. I'm going to go to the outcomes piece as the last piece, because I pretty much covered the introduction kind of things for the PowerPoint, the overviews of the templates and what you're going to need to do there, and the strategies and interventions. I've talked to you about the reference sheet and talked to you about baseline data. So I think the last biggest piece is about the outcomes, especially because I'm not sure if everybody on the call uses the same outcome terms. Sorry, I'm flipping the slides around a lot. And so I want to make sure everybody was on the same page with that, because we're asking you to decide what outcomes you're going to share, short-term, intermediate, or long-term. This, for those of you who can see the slides, which is hopefully everybody, just kind of is a different way to show sort of a logic model example that covers all the elements that are covered in the PowerPoint templates. So we already talked about the problem and the data that you're going to have, the root cause and the data, or the root causes that you've addressed successfully, the local conditions that you've addressed successfully, and the data. So when we talk about short-term, intermediate, and long-term outcomes, we're looking for positive changes in the same measures that you looked at to identify those problems. So if you're looking at 30-day use, if you're looking at age of onset, say for underage drinking, if you're looking at binge drinking rates, then your long-term data, coalitions that have achieved long-term outcomes, are going to be those who have achieved reductions in those substance use rates among youth. Those coalitions who have achieved intermediate outcomes will be able to show some positive changes from that baseline to whatever your most recent data collection point or points are, which could be a year ago, because I know that some of you, at least for the student survey, only collect your data every couple of years, so you don't have to worry about that, but it's your most recent data point that you have. That's going to be considered your intermediate outcomes. So have we changed the root cause? If we have, and we have data to demonstrate it, then we've achieved intermediate outcomes. Do we have local conditions data? And hopefully there's some things that you're tracking there, whether it's qualitative or quantitative information that you can share. But again, I talked about the dominoes knocking down, and those are the kinds of changes that we think you can achieve most quickly. Sometimes that's even a policy change, whether it's formal or informal, but all of those are contributing to ultimately the changes in the root causes. So just remember that the data that you're sharing at the end in the outcomes section, when you're asked to share community level outcomes that you've achieved, we're going to be looking for descriptions, images, graphs, charts of changes, positive changes in those exact same data points. There's a lot of outcomes that you probably have to share, so depending on how much space you've used for the rest of the PowerPoint, you're going to have to figure out how much you want to share with us. So where you're telling your community story to someone who doesn't know anything that you're doing. So again, it's just thinking about what's the most exciting outcomes that your group has that you want to share in each of these categories. And another thing that I'll say is we're going to be able to make the decisions for you about these short-term, intermediate, and long-term outcomes, and that's going to be part of our review as well. So just like we're going to see if maybe you could use a little work in describing your strategies and activities in the 7 behavior change categories, if we see a short-term mixed with an intermediate or something, but your outcomes are there, we're not going to ding you on that either. We're going to be assessing your application using our brains, and we're going to notice when something was maybe just a mistake on just the part of kind of understanding all of this stuff, and we'll be able to move coalitions through who've been able to demonstrate that they've reached these things, even if there's some things that they need to improve in the application itself. I'm trying to think if there's anything else around the outcomes. I would say that we're looking for trend data whenever you have it. So that just means if you have data, if your baseline data is in 2008 for your long-term outcomes and you've achieved long-term outcomes, then show us as much as you can. And also, we like to see that the outcomes are occurring in your target population. So not sort of picking out, we have outcomes in just the 12th graders. That's good, but against another coalition who's able to show that there's been community level outcomes for their entire youth population, that one is going to be a stronger applicant. So you really want to try to demonstrate that the coalition is affecting everyone in the population and doing things that are going to affect the entire community. I think that that's kind of everything that I really wanted to cover. I wanted to be able to give you tips, and I think I knew I was going to be incorporating some of those throughout, but I would just suggest that you, as a next step, that like I said, you review every one of the application materials and read it carefully, make notes on the side, ask questions, write anything down that's confusing. I would, if you're ready to do this and you're excited, that's congratulations. It's exciting, and I'm really looking forward to working with you, and so is the rest of our evaluation and research team. I would connect soon with your evaluator or whoever, if you don't have an evaluator, whoever it is that's working with the data, that's familiar with the data, talk to them about this, get other people on board, see if you can't assign some of this work to people. You have a little over a month, and I think if it's a team effort, it won't be something that's just one person having to take on. I keep repeating that because I've seen that happen on a number of occasions, and it seems like a really stressful experience for people, and I don't want anyone to have that. This should be fun because in the end, you're going to learn things, you're going to put all of the materials together in a way that you've never done before. You're going to identify some gaps and some things that you're going to work on, so some new goals are going to come out of it. You're going to get to work with us, and you will have something that you'll be able to share, a PowerPoint, a presentation, materials that you'll be able to share in your community, whether that is in a presentation format or in a grant or something else. I think it'll be really useful. You just want to be able to review everything that you already have so you don't reinvent the wheel. Any graphs and charts that you've already shared with folks that you can integrate, again, so that you don't have to recreate things or start from scratch. And I think I mentioned before, our team isn't going to provide really detailed application feedback. We're not going to look at your application and walk you through it in the way that we will for the second phase of the application. But there's sort of this fine line that you do have an opportunity at any time to contact our technical assistance and training manager. And I'm going to have to send out an email after this call. I'm going to send everyone her contact information because I just realized that I didn't include it here, but it's 1-800-54-CADCA extension 240, and Jackie Rhodes is our technical assistance manager. So for those of you who don't know, she's always on the phone and can help you for free anytime on any issue, and one of those issues is working on logic models, working on assessment, and working with data. And so if you, say, shared your logic model or shared some of your data and had certain questions about it, or certain questions about data presentation, but not the actual application itself, she would be happy to help you and walk through some of that. So we are here to support, to answer general application questions, and always here to support you with any coalition issue that you want to work on. So hopefully you'll take advantage of that expertise. And the final thing that I'm going to be sending out to all of you, and I just didn't want to send it to you, I didn't want to talk about it on this webinar because I thought it would be a little bit overwhelming, but we do have a rubric. Yes, I'm talking about templates and data interventions and rubrics. It's like not very exciting, but we have a rubric about logic models and all these things that I just talked about, the root causes, the local conditions, and the things like naming one question at or one issue at a time, being really specific. These are the kinds of things that we're going to be sort of assessing the phase 1 applications on, and I'm going to give you what we call as sort of this exemplary guide for coalitions around logic models. I'm going to send it to all of you and post it on the website, and that will be something that any of you can talk about in your conversations with me or asking questions. But I wanted to put it there so that as you work through the templates, you can remember some of the things I said in this rubric, keep in mind the things to think about and that are the exemplary, but at the same time not get overwhelmed if you're not meeting every item, because really it's just a work in progress. Every coalition work, the beauty of all of this and of evaluation is that you're constantly evolving, and we expect that. There's no perfection ever, and it's just really exciting to have a group of coalitions who are who are achieving successes, and congratulations to all of you for that, and who are ready to get together and really tell their story and try to get recognition for all their coalition's great work. So I wish that you all were in the room with me so that we could have actual face-to-face chats and nodding heads and all of that, but for now I'm going to have to just kind of give a couple moments of silence and see if anybody has any other questions, and then just really encourage all of you to please take advantage and give me a call, send me an email, tell me, I heard the webinar and I'm thinking about definitely applying, get on my list so that I can start getting in touch with you and just clarify anything that wasn't clear on this webinar and get to know you a little bit. So I see a couple people are typing, and I'm going to give a moment, and then we'll be able to end a little bit early, which I thought would be nice. Thank you, Lori Ann. I'm glad it was helpful. I hope it was helpful for others. So I'm going to, I suppose, say goodbye. I think a couple more people are typing. Oh, is that the same last name? Oh, Graber. I thought that Renelle had the same last name as my colleague Samuel Gaber, but it's Graber. All right, well, thank you so much, everybody. Have a great day, and I look forward to getting to know each and every one of you.